Good morning. It's really a pleasure and honor to be here and share with you the ideas and some of our lesson learning from the region, especially for Latin American. And I want to give for a very a good time for my colleagues in this meeting, Angela and my other colleague and all the attendants. The first idea I want to share with you is the importance that we must have to think in access to vaccine and access to the immunity. And that means that we need not only the product, we need more than that. And this is my first idea that I want to share with you. For instance, Latin America, it's constituted by a continental and island areas. We are a multilingual and multi-ethnic people. Our main production is agriculture and services. Even we don't have dictatorship or war conflict. However, we have a very political crisis in the several countries, and unequal is within each country and between the countries. But also we are a very highly biodiversity area. It has a high percentage of indigenous population, high percentage of female heads of household, high percentage of workers in the informal sector of the economy, high coverage in primary and secondary education, however, not necessarily public and the high quality. And our health system mostly are fragmented and segmented, low coverage, limited performance in primary health and care and intensive care units, according with the report with the Economical Commission. With this picture, I want to show you the difference that we have in our continent and in our area. This is a view from a huge building that they show the difference that this kind of life that we have in the region. For one hand, we have the favelas, and in the other hand, we have this kind of building that reflects the difference, the very close difference that we have, but also a huge distance between the condition of life of these people and the access for the different goods and education and health. This is from Brazil. The Economic Commission for Latin America report prior to the COVID-19 that the region had low economic growth. Once the pandemic started, the Commission asked and was asking for all over the world, but especially for the governments in Latin America, that there could be a paralysis for the economic activity and a great recession more than that we have in 1914 and 1930. And the collapse of the international trade, the increase of the unemployment, the poverty and the inequality, and also the World Bank estimates an increase in poverty and extreme poverty. With this context and the COVID, when the COVID arrives, this is a picture that the artist also from Brazil try to show how we feel the COVID in this context. Is death, desolation, isolate, and almost we feel alone. Every cross of that show the isolate and how the people feel around the COVID-19. We need to change this. We need to change this, and the vaccine and the immunization can be this kind of threads that they can hand all the people together to change this terrible and devastating feeling that we have about the COVID-19. And I know it's not only in Latin America, it's all over the world. One of each two diseases in Latin America, with only 8% of the population. This idea tried to bring you the idea how we are feeling this devastation COVID-19 in our region. Also, the director of the Pan American Health Organization, in her speech several weeks ago, recognized that we need to improve the regulatory capabilities in immunization, build post-marketing surveillance for vaccines, strengthen the vaccination programs, and improve and adapt our cold chain facility. But in this condition that we have these huge inequalities in the region, we have to think in how to approach this challenge together. For instance, Argentina, Brazil, and Mexico has in the phase of phase 3 for the clinical trials project in order to have a various efficacy option and try to avoid the distribution problems. Proposal for equitably access to innovation has 3 trends that I really try to share with you. One position is the high-income countries and vaccine producers that they are asking for the nationalization of the production. This could be a hurdle, and we have to be really looking for this kind of strategy. For the low-income countries, some global groups have stated as priorities, and others consider subsidies. But what happened with the middle-income countries? We don't have clear priority. This is not clear for the countries, and I think it's not clear for the companies, and also I think it's not clear for the global institution. We can read several papers from JAMA, Lancet, and some news from the different papers that they are announced some news, but also is from the high-income countries and the low-income countries, and sometimes we feel that we are not exist in this global strategy. And in this sense, the call for action that the Costa Rica made to share the knowledge and innovation does not have support of the countries or companies that are producing vaccines. And we ask why. And I think this is, I try to give here the voice that we need to be all together. We don't can divide the world only for the people who has a high or low income. And also the immunization against the COVID-19 must be a global public goal. And that means for me, it's we have to to really put in the discussion that it is a price or a cost. It's a campaign for solidarity or for profit. Who will assign the amount of the vaccine for the countries? I was listening the idea that maybe we will have the 20% for the population. And this is very important really to share with you, for the governments, for the people, the policy makers. They will have, if we go to this way, we will put the decision and the governments and the decision that who will be the first, but also who will continue to take the COVID-19, because we don't have all the vaccination for the all people, for all the generation. And this is additional cost for the health system. And we have to think about that. In what will be the priority groups? Maybe the elderly could be, we can, imagine the elderly people, but what about the health workers? What about the people, the poor communities, or the most vulnerable people? We put all of them on the last list. I think we have here an ethical issue to handle. And for that, the ideas for the proposal is we have the urgent global agreement on access on immunization. And for that, we have to support the health system and primary healthcare strengthening. Priority groups to be vaccinated have to be established. A cost is agreed, not a price. The industrial capacity of the countries has to be strengthened also. National legislation in pandemic situation has to be strengthened, like the several countries in Europe. We don't have this kind of processes in Latin America. And it's designated from global platform based on equity and social justice. And of course, to do that, we need the multilateral financial agency, NGOs, and the WHO establish a fund for sharing production and distribution of effective vaccines. And of course, we need the production, the companies on the territory to define the cost and establish agreement with other companies for mass production. And the technological transfer mechanism has to be established without transfer of cost or risk to the countries, with a high level technological development and production. As this is the case of Brazil, but also the case in the Costa Rica, we have a very good technological platform, but a medium production capacity. We need to support this kind of autonomy for the different countries to support our region and not be involved in a global platform that we can be behind or at the last of the list. And of course, how to do that with a region more inequality. We need to work together. We need to put all the voices in the table. And of course, we need that the people in the table listening the needs from the countries and from the region. I want to give the grateful acknowledge to Dr. Alvin Chavez, the Costa Rica expert, that they gave me some ideas to this presentation of Marta Levis. I'm sorry, I have a error in the last name of Mirta. It's Mirta Levis of Argentinian expert. Thank you very much, and I will be here for the comments.